Monika from Northwestern Specialist in Plastic Surgery, and this is Dr. Schierle.
How's it going? Thanks for joining us for another video. Today we're going to be talking about mastopexy, otherwise known as a breast lift. Breast sagging is completely normal and natural, and breasts that are saggy are perfect just the way they are.
Gravity.
That being said, yeah, time and gravity, breastfeeding, nursing, weight gain, weight loss, these are very common reasons why breasts will get bigger and then smaller, and anything that gets bigger and smaller will sometimes not tighten up the way that it once was. And so you have what is a disproportion between the surface area, or the skin, and the volume, which is the breast tissue inside. So you either have too much skin for the breast that you have, or not enough breast for the skin that you have. And that represents the two different ways that we can typically treat this issue if patients are dissatisfied with the shape and appearance of their breast.
Question for you: when, with the degree of drooping for patients, what is the ideal breast? Like, where's the nipple supposed to be? Like, what does the textbook say?
So
the perfect breast.
Yeah, there's no such thing as a perfect breast. Everyone's perfect just the way they are. That being said, typically a phrase that I will sometimes use when I'm examining a patient is, are your nipples looking at me, or are they looking at the ground? So most women, have this sense in their mind of what their breasts should look like. Now, of course, we get that sense from the media. We all read People magazine and not National Geographic. So perky, round, full breasts that are really somewhat unrealistic are considered the ideal. Now, that being said, we can help you achieve that ideal so that you can feel more confident and feel better in or out of your clothes with a simple office procedure of a mastopexy. Sometimes it can be done in the office, sometimes it needs to go to the operating room. And that's the kind of stuff that we can help work through during your consultation.
So typically, the incisions are around the areola, down like a lollipop, and then occasionally there's an anchor underneath the breast. Sometimes we can get away with a J or a small little anchor, just depending on where there is extra skin. So where there's extra skin, there needs to be an incision, and we kind of determine that, at the consultation, but more specifically right before, when we're working for the procedure, we have that conversation with the patient.
Yeah, we always give a patient the least amount of scarring possible that we feel like is going to give them the results. So as Monika was saying, the more skin you remove, the more powerful the lift is. So someone who's really droopy might need more skin removed, and that means more scarring. Sometimes you can make up for that by adding a small implant to the procedure. So sometimes we do combine a small implant with a small lift. That's called an augmentation mastopexy, or breast lift with an implant. And it starts to get really complicated because you're talking about being perkier, tighter, smaller, bigger, a lot of math, a lot of geometry, a lot of aesthetics. But these are the kind of things that we will work through with you very, very thoroughly at your examination and consultation, so that you can make sure that you make the best decision for yourself.
We definitely often have patients come in for a breast lift consultation, and they actually end up wanting an implant because what they are showing us in the consultation, they're actually lifting their breast up to their chin, creating kind of fullness at the top, and that's unfortunately not achieved with the mastopexy or breast lift. That will require an implant, whereas the breast lift, I would say, still maintains that nice teardrop shape of a natural breast.
Most of our patients after mastopexy are going to experience some pain or discomfort maybe for a day or two. They'll be sore for a week or two. It can take a month or two for the tissues to settle and the scar tissue to evolve and swelling to go down, where you see your final results. And the scars can actually continue to fade for up to a year or two and continue to look better and better. We typically ask patients to refrain from really strenuous activity for just a week or two. This is great for a lot of our younger moms, which is definitely a huge population that this procedure can typically benefit. Because if you've got young kids running around, the idea that you're not going to lift up your 2-year-old for 6 weeks is just really unrealistic. And so we ask the patients listen to their body. After the first week or two, if you've got a little bit of extra help around, then you can start doing anything you want in terms of exercise, vigorous activity, heavy lifting, as long as it doesn't hurt. So you have to kind of listen to your body. If your toddler is inconsolable, you need to kind of sit down, try to calm them down. You can give them a hug and then stand up so that you're using your hip or your arm instead of using your chest to lift them. But yeah, people are able to kind of bounce back and get back to the swing of things pretty quickly.
Yeah, I would say the recovery for mastopexy is a lot quicker than an augmentation because we're not really messing with the muscle. We're not spraining the chest per se, so it's mainly just kind of skin. So it's just more kind of incisions that you need to take care of, which is pretty easy since we put on surgical bandages over all the incisions, so there's not much maintenance in terms of that.
All right, well, hopefully that answers a lot of your questions about mastopexy or breast lift. Be sure to subscribe and click the bell notifications so that you're notified when we post videos like this. If you find it interesting, please feel free to leave a comment or question in the comments below, and we will see you next time.
Bye.